Hi, I'm Dr. David Rubin from the University of Chicago, and this is Best of the Day from the Advances in IBD meeting held in Hollywood, Florida from December 12th through the 14th. Joining me right now is my colleague Maureen Kelly, who is a pediatric nurse practitioner at the University of North Carolina in Chapel Hill, and she also has an appointment in the School of Nursing at the same institution. Maureen is part of the program here at the Advances meeting and has been part of the planning for this meeting as well. Welcome, Maureen.
Thank you.
So the nurses program occurred this morning.
Mm-hmm.
It looks like a really rich program this year. And from what I heard, there was a record number of nurses in attendance this year. So that's really great. Tell me a little bit about what was in the program.
So we had 4 regular talks. 2 were pediatric and 2 were adult. The first talk was on general health maintenance. The second talk was on ethical dilemmas in pediatric care. And then the next one was on women's health. And then I gave a talk on the 504 plan for pediatric patients. And then in addition, we had 2 oral presentations from abstracts. One was on the use of dietary fiber, and then the other one was on symptom burden with disease.
So really a rich agenda.
Very much
Why
so.
don't we start with some of the health maintenance needs for the patients and what we've learned and how we can incorporate best a team approach incorporating our nurses and advanced practice nurses.
I think it's a big issue to make sure that all the health maintenance problems are covered. And I think it's a really good role for nursing and nurse practitioners to make sure that the patients have had their vaccinations, to make sure that they've had their screenings. I know we look at that very closely in pediatrics, trying to make sure that we're screening them 8 to 10 years out if, in fact, we've been following them for a very long time. She certainly talked about TB testing. She talked about depression screening, just a myriad of surveillance that we really look at with our population, probably focusing most on vaccinations.
And there's been this shift, this palpable shift over the last few years, I think, from more of a crisis management IBD strategy to recognizing this is a chronic disease and we need a chronic disease model.
Right.
And so it's just great to see our team incorporating all these different strategies. The problem has been really who does which parts and how do we find enough time to cover all these things, right? So that's been a challenge for us. Did Sharon have any suggestions about how we can do it more effectively?
Well, Sharon talked about a couple of different things. One is who takes care of it within our setting. In other words, is it the nurse practitioner's job? Is it the nurse's job? Is it the physician's job? But then she also made a really good point of these patients need a medical home. And we often see much more of them than their primary care provider. And it's very, very important to incorporate the medical home and have the PCP be on board with what immunizations need to be done at what point in time.
Yeah, well, that's a great suggestion. What about for the general gastroenterology practice, where they don't necessarily specialize in IBD or they're not part of an IBD center? How can the nurses in that practice learn a little bit more about this and incorporate it into their very busy responsibilities?
I think that's a really good question. I think that those patients we tend not to see as much. We're a little more dependent probably on the PCP for some of these screenings, but again, we're trying to make sure that we're getting this all done.
Yeah. Well, it's great that there's so many nurses here learning, and hopefully they're going to bring it home to the rest of their colleagues, and those who are watching right now are going to learn this too. Tell me some of the ethical dilemmas that we face and that the nursing colleagues face in taking care of these patients.
So Teresa Walks did that presentation from Seattle Children's, and she talked about the difference between when the parents and the provider and the child, any of that group disagrees with the treatment plan. And she gave some excellent suggestions on how to help with that and the reasons why. You know, do they not understand the whole plan? Are there financial issues? Are there cultural or religious issues that are preventing them from prescribing to the plan that we've set out for them? And then she just gave some real practical suggestions of how we can help. Second opinions, resources such as the CCFA, talking to other families who have had a similar experience. It was very good and very practical.
Oh, that's really helpful. There's some big challenges we face in communication, and at our center, the most common reason for ethics consultation really is about families that are disagreeing regarding decisions that are being made, and it can be a real difficult problem. You spoke about the 504 plan. So why don't you teach our audience a little bit about what that means and what it is and how it can influence the lives of our pediatric population?
That's something that's very near and dear to my heart, and I try to implement that process as soon as we diagnose our patients. And it becomes even more important if you're diagnosing an early teenage, middle teenage patient, because there's so much testing that comes up during that period of time, and if they need special accommodations for it, it's vitally important. Oftentimes people confuse the IEP or the individualized education plan with the 504 plan, and they're entirely different animals. The IEP is for children who need specialized instruction versus the 504 plan is children who have a disability, and that requires special accommodations in school to be able to learn as well as their peers.
And having a diagnosis of Crohn's disease or ulcerative colitis counts in the 504 plan.
Correct.
Where should our colleagues look to learn more, or what resources exist if they feel like their patients or their families are not accessing the accommodations properly?
The best place to start is the CCFA website. There's probably 5 or 6 excellent resources there. There's a sample letter. There is the brochure for teachers and other personnel. And that's really where we find a lot of difficulty is teachers don't understand what it is. They think children are trying to use the bathroom because they're trying to get out of class.
Right.
They confuse IBD with IBS. So we really do a lot of education with the schools about what IBD is.
So for those out there, it's www.ccfa.org, and it's a great resource for many things, but that's really important to know. Tell me a little bit about the research that was presented today.
So there were 2 research studies that were done. One was done by Carol Brotherton, who is at George Mason University, and she, as part of her PhD work, she had looked at a study using dietary fiber for Crohn's disease symptoms when the patient has active disease. And it was a very small study, but it was an interesting study that I think can be built on using dietary fiber. Fiber cereal. And the patients all did much better with improved symptoms on that diet.
Well, we certainly know our patients are craving, to use a pun, dietary information and recommendations and advice. And symptom management with diet is something that I think we can all agree is useful now. And learning a little bit more about how it modifies the disease process is where we need to be going. So it's great to hear something like that was presented as well. So as the world of nursing and IBD continues to expand so wonderfully, what would be 1 or 2 things that you think that the nursing colleagues and the other folks who watch this, who want to educate their nursing partners, should know about IBD? What are the main messages that we want to make sure everyone's aware of?
I think one of the main messages is certainly treatment plan. How we all work together to formulate a treatment plan. And I think it goes back a little bit to that ethical dilemma. When parents aren't on board, how do we help them get to where they need to be for the appropriate treatment? And certainly, when you think about what parents read on the internet, and what people, not just parents, but adults read on the internet, they're scared. And so I think we as nurses can help educate our patients better for preparation for quality of life. And again, as a pediatric person, I think that a lot of parents worry about what's going to happen later on to my child, but if they can't get out of the bed and go to school, then we need to do better education on what our options are for treatment. I think the second thing that I would probably say, whether it's pediatrics or adults, I'm seeing a lot more nursing involvement in the care of IBD patients. And I think so much of it, especially the psychosocial issues that we know impacts our pediatric and our adult patients, are so important. And nursing is a perfect fit for that role.
Mm-hmm. It's absolutely true. And I think that the recognition of the value of nurses as primary providers within our practices and as important members of a team approach to our patients is not only important for patients to appreciate, which I think comes naturally once they know about it, but also for hospitals, medical centers, payers to value as well. So we really need people to understand that inflammatory bowel disease, especially as a chronic condition that requires all this type of care, is different than many of the other acute care models or even other chronic diseases. And so I'm just grateful for your leadership and for the work that so many of our colleagues are doing to raise this awareness and to push this agenda forward, because it's critically important for the future. So thanks for joining me today.
Thank you. I enjoyed it.
I'm Dr. David Rubin, and joining me has been Maureen Kelly from the University of North Carolina in Chapel Hill. This has been Best of the Day from the Advances in Inflammatory Bowel Disease meeting in Hollywood, Florida. This is our final session, but I hope you'll join us in the future.